Join us for an inside look on Snapchat of our practice, operating room, and what goes on behind the scenes here in our office. I get a lot of questions about my training and certification. Here is the fancy certificate wall. This is the route that I've taken. I graduated Colorado College. I didn't start there, though. I transferred in and graduated. At CC, I studied political science and economics, and I graduated in 1989. It wasn't until 1992 that I started medical school. Before going to college full-time, I worked in the theater and in television studios and did some electronic stuff. And then after college, I actually took the year off for skiing. And while working the lifts and working kids ski school at Loveland, I ended up going back and started taking pre-med classes. That took about another year. Then I worked in a biomedical genetics lab for about a year, took my MCATs, and was fortunate to get into medical school starting in 1992. In medical school, I think I spent my first 2 years trying to talk myself out of becoming a surgeon, and that worked really well all the way up to the time I got in the operating room. My first clinical rotation was in surgery, and I knew I had a problem. I was hooked. My first elective was ENT, and when I saw rhinoplasty, I was hooked. When I told my mom I'd figured out what I wanted to do, that I was going to go into ENT and do rhinoplasty and reconstructive surgery, she kind of laughed it off, but it is what I ended up doing. I went on to internship in general surgery and then 4 years of ENT residency in many of the local hospitals here in Denver. By the time I got to my chief resident year as an ENT surgeon, I knew I was going to plastic surgery, and I was fortunate, got my first choice at University of Alabama, Birmingham. I had the great honor of working with Louis Vasquez as my chief of plastic surgery. I took my boards in otolaryngology and became board certified my first year. Plastic surgery residency was outstanding. A lot of reconstructive surgery, free flaps, breast reconstruction, trauma, and aesthetic surgery. The specialty of plastic surgery actually comes from reconstruction of war wounds, and I'm convinced that reconstructive surgery stands as a distinct, helpful advantage in our training. After 7 years of residency, chief residency in both ENT and in plastic surgery, and a year of practice, I was able to take my written boards and be invited to sit for my oral boards in plastic surgery, which I would describe as a very, very stimulating weekend, defending my own cases in exam. I was asked to present and defend rhinoplasty case, cosmetic breast cases, and I had a gunshot wound complete reconstruction of the face. That case was my friend Rex. He become my friend because I did so many operations, free flap, and all kinds of things to help improve his status. Rex had tried to commit suicide with a gun. I saw him recently for his 10-year follow-up, and I reminded him that I told him I would kill him first if he tried to commit suicide again. And through years of facial trauma at Swedish Hospital, reconstructive and now aesthetic surgery, I have found plastic surgery to be one of the most personal specialties in medicine. My practice now really calls on all those years of experience, not only as a surgeon, but also even the theater and the television studios that I worked in. Follow us on Snapchat, Instagram, and at DenverBodyDoc.com. Thanks.